Hi all, my name is Dr. Julio Blasco Jimenez.
Hi, my name is Gabriel Shepard. I'm the Director of Benefits in HRS for Brown Physicians Incorporated.
Today here, Gabriel is going to answer all of my questions about health insurance. So I know very little about healthcare insurance and what type of healthcare insurance should I have? Should I update my plan? There's so many options in our coverage. Can you help me understand what are the big categories of different plans that we have options to?
Oh, sure, I can answer that for you. We have 3 different choices of a health plan for you. We have an HMO. HMO requires a PCP and referrals required at every services. We also have a PPO plan, which basically you have a flexibility of choice of seeking care of any facility or any provider as part of the network. Or you can have a high deductible health plan.
What's the difference between the HMO and a PPO in terms of cost?
Things with HMO plan is a PCP is required and a referral is required at every service. However, your plan cost out of your paycheck may be lower, but it could be more out-of-pocket expenses for you for co-pays and deductibles. And with the PPO plan, it works similar to a HMO, but however, there's no restrictions on your provider network or where you see coverage. A PPO plan may cost more out of your paycheck, but it gives you more flexibility of choices around the country.
When you mention that there's a high deductible, what does that mean?
So a high deductible means that the amount of money you will pay up front before the health plan pays any claims for you. One of the interesting things about a high deductible health plan is consumerism. When you're in a PPO HMO plan, what you pay out of pocket is normally not a factor when you're choosing healthcare costs for your family, because you don't see the cost. Normally in those plans, all you pay is a copay, $25, $30, $50. When you're in a high deductible health plan, you're paying the full negotiated rate of that service itself, which could be hundreds, if not thousands of dollars. Now you as the plan participant, you think twice now because that money is coming out of your pocket. So you think wisely of how you want to spend it. Some insurance carriers provide tools that shows costs before you incur the expense. United Healthcare is one of those insurance companies in the plans they offer. It's a cost analysis tool. Say you're getting an x-ray. You need an x-ray of your arm. And their cost analysis tool, you put the service you need. It will list every facility, radiology in the network. It lists every cost for you. So you can choose where you get that claim from. One service may be $1,000. One could be $800, it varies. But now you have the information you need as a consumer to make the right choice for you and your family.
And with that plan, once I meet my deductible, what happens to the rest of my payments if I have more services that I need?
So in a high deductible health plan, once you reach the deductible within a calendar year, you will have no more out-of-pocket costs for that plan, co-pays and deductibles.
Okay.
At that time, I do encourage participants to go get all the elective surgeries you need. Because at that point, you have no out-of-pocket cost.
Fair enough. Is that when the potential of an HSA, FSA comes into plan?
Yes.
Okay.
So that's a good segment to talk about HSAs.
Okay.
So an HSA can only be paid with a high deductible health plan. And it's different than an FSA. An HSA, health savings account, is a checking account at a bank that's owned by the employee participant.
Okay.
That account follows you wherever you go. So even if you leave this employer, that account is yours, you're entitled to it, and you can continue using it for health-related expenses. Unlike an FSA, it's owned by the employer, and it's a estimation game. You have to estimate what you think you might need for you and your family for the current or future calendar years. In the event you do not use the funds, you lose it.
Okay. But the HSA, if I put in money into it, I keep it.
Correct. It works just like a normal checking account.
Just like a checking account.
But however, it's restricted to health-related expenses only.
Okay. In an HSA, I can invest that money.
Yes.
Okay.
Same as your retirement where you invest it on a stock market. Some HSA companies allow the option to invest your money on their retirement platform. You can purchase mutual funds, etc.
Okay.
So while the money is sitting there, it can grow.
It can grow afterwards. And that means that in the future, if I wanted to pay for healthcare costs that, let's say 10 years ago, I got surgery on my spine, paid with it out of pocket for my copay, then I can use the HSA later?
That is correct.
Correct, okay.
And one of the cool things about an HSA is some people see it as 2 separate and distinct items.
Okay.
Some people see it as a supplemental health plan to where you pay for your deductibles and copays, and some may see it as a medical 401k. They're dumping money aside for the future for a war chest post-retirement.
Okay.
They're not worried about expensive today. They are paying out of pocket for any expenses today. Their mindset is, I'm putting money aside for post-retirement.
Okay.
And as claims come up day by day, I'll pay those claims out of pocket. In the current, as I'm deferring money to my health savings account, I'm getting a tax break on it, meaning that it's lowering my taxable income for tax purposes, federal and state.
Okay.
So that fund I'm putting in my health savings account is lowering my taxable income. In the future, when I do retire, I'll have a separate pool of money dedicated towards my healthcare expenses post-retirement. I can use those funds to help pay for my supplemental Medicare plans or pay for any kind of health-related expenses for myself.
And to clarify, the HSA FSA is only an option on high deductible plans. On my HMO PPO plans, I could not get it.
Just clarify, an
Yep.
HSA can only be partnered with a high deductible health plan.
Okay.
An FSA can go with no health plan or any health plan.
Okay.
However, if you are enrolled in the high deductible health plan, you cannot choose a full FSA. You are eligible for a limited FSA.
Okay.
A limited FSA covers everything but medical, vision, dental, etc.
Okay.
The rationale behind that is, if you're enrolled in a high deductible health plan, you have a health savings account that pays for your medical expenses.
Okay.
If you want to defer more money, you can use a limited FSA. However, that will be restricted to dental and vision expenses.
Okay. Let's say that my partner has insurance already. How would I know whether to join my partner's insurance versus joining my company's insurance?
There are many factors involved in that.
Okay.
And one of the main factors is knowing you and your family's health situations.
Okay.
Also understanding what you pay out of pocket for the prior 2 calendar years to understand what you may pay in the future.
Okay.
Not every plan is the same. Even though different employers may offer HMO plans, they may be the same in name, but not in the services covered.
Okay.
So one thing you want to compare is the plan cost out of the paycheck, the plan deductibles and copays, the services and network, and see how that compare with you and your family's health situations.
Okay. So broad situation, it depends mostly on your personal situation, really. Most insurances allow you to actually, when you start a job, you can enroll in that plan right away. But let's say that I am moving on from my current employer, and that means that I'm gonna no longer have health insurance during a period of time. What options are there for me in between the time that that I'm ending my contract with my current employer and I get a new employer?
During that time period, most employers have different rules to when coverage starts and when coverage ends.
Okay.
Most employers choose the first of the month for coverage to start or the end of the month when you leave.
Okay.
In those situations, you have to determine when does your new benefit start and when does your current end. Under federal law, every employer must offer you COBRA when you leave an employer.
Okay.
COBRA is basically offering the same medical, dental, vision plan you currently have, but you're paying the full cost of it for 18 months.
Okay.
And that can suffice as gap insurance until you reach your next employer's insurance plan.
Okay.
But due to state healthcare exchanges, I do encourage employees first to look at your state exchange to find a comparable plan before you enroll in COBRA.
I know nothing about life insurance. What should I know if an employer offers me life insurance?
One thing with providers is they tend to change employers year to year. So I do encourage those that they may want to obtain their own personal private policy and not rely 100% on employer policies unless you know the employer you're going to be with is where you're going to retire at.
Okay.
Most employers offer free life insurance at their cost. It can be anywhere from 1 time, 2 times, up to 5 times your annual salary.
Okay.
However, there's something called GTL, Group Term Life.
Okay.
And this is an IRS tax on an employer life insurance that is valued above $50,000. Basically, the IRS says, hey, If your employer is offering you free life insurance, it's free up to 50 grand. But any amount above that becomes taxable income.
Oh,
You can either pay the taxes when the death claim is filed or pay the taxes up front as the premiums are being paid. Most employers opt in to GTL, meaning that it is free for every employee. But however, on your paycheck in your W-2 form at the end of the year will be a calculated tool that tracks a number of the value of the GTL,
okay.
and you'll use that amount there to put in your IRS 1040 form. That amount on your GTL doesn't mean the amount you pay in the taxes. Based off your full taxable wages on your 1040 form, that amount could be significantly high or significantly low, depending on your age and annual salary. For those people who are above the age of 60 and make over $500,000 a year, your GTL tax can be hundreds of dollars per year. If you are under 60 and you're under $400,000, your GTL tax could be tens, if not hundreds of dollars per year.
Okay.
And the question is this tax I'm paying worth this free benefit worth $100,000, $200,000, $1 million? And most of the time, the answer is yes.
Okay. So what about, I'm finishing my residency, we start getting a bunch of offers about disability insurance. What should I do about that?
So that varies, and every employer can offer different disability policy with different definitions. Disability comes in two parts, short-term and long-term.
Okay.
Short-term disability starts from day 1 through 179 days. Most employers offer this. It can be from 40% up to 170 pay.
Okay.
If it exceeds more than 179 days, it turns to long-term disability. Now, long-term disability can go from month 6 all the way up to retirement age.
Okay.
Normal disability plans, they have a definition of disability. Some may have own occupation. Let's say I'm an accountant, and I injure my arms and can no longer work on a spreadsheet anymore. So by the insurance definition, I'm disabled. By other plans, they say, hey, no, you can still be a Walmart greeter.
Oh.
So they will actually force you to take a job maybe undesirable to you,
Yeah.
but they're saying, hey, you still can work in any capacity.
Fair enough.
So you kind of do want to find a policy that has your own occupation built in.
Yeah. Yeah, like I'm a doctor, I see patients, but if I'm wheelchair bound now, I wouldn't want to be
Doing research.
doing research. But now if it said like own work, was it?
Own occupation.
Own occupation, then I would be fully disabled immediately. Thank you so much for this. This has been extremely helpful. You've answered all of my questions.
Oh, no problem. This is the best part of my job. I love explaining employee benefits.